So the first disclosure, as some of you, most of you know, I am left-handed. So therefore, a little bit biased on this subject. A lot of the material here is anecdotal, but some of it is literature-based as well. So to set the tone for this talk, I will start with this illustration. Over these past 4.5 years, I found out that many of you have fathers, mothers, sisters, brothers, daughters, sons that are left-handed. I've even had a scrub tech ask if I was truly left-handed. I thought that was kind of funny. No, I've just been trying to torture everyone for the last 4.5 years by making you reload my needles. So the objectives today are to talk about quick statistics, review my left-handed journey and how I got to this place, highlight specific challenges to lefties, discuss the surgical literature as it pertains to the left-handed trainee, and overall, and probably most important for this audience, is just to increase awareness and provide better ways to assist the left-handed resident, as there are a few of us out there beyond me. So some quick statistics. As you probably know, 10% of the world population is left-handed. They debate this if it's a genetic thing or an environmental factor, but most of the time it's decided by the time you're 6 months old. So I didn't do this to anyone on purpose. Interestingly, in accordance with this, 10% of surgeons are also left-handed. There's more of a male predominance than females, but I thought that was interesting that it corresponds. Offhand, there are 10 faculty members that we work with at various institutions who are left-handed. Some of these will come as a surprise. And there are at least 4 current residents who are also left-handed. They won't be depicted here to preserve the anonymity in case they're trying to keep it a secret for you. So here are the faculty members. Like I said, some of these might be surprising, as a lot of them do things right-handed. There are varying degrees of left-handedness, as I've found over the years. When I was discussing this case with Dr. Lair from North Kaiser, he told me, "Why would you present me? I'm not left-handed. I do my bovine and my cutting with my left hand, but that's it." No. And although Ben Keller is not a faculty member we work with, he was a long-standing fellow left-handedness that paved the way before me and stuck to being predominantly left-handed. So he deserved an honorable mention today. In the surgical literature, unfortunately, there are only 2 left-handed surgeons that I could find depicted, William and Charles Mayo, who are the founders of the Mayo Clinic in Rochester, Minnesota. To this day, the residents and faculty at that institution still gown and glove with their left hand first in honor of these 2 lefties. Wow. So why talk about this if there's only 14 of us that this really pertains to, right? So the first point is, and the inspiration behind this talk, was a new intern saw me writing with my left hand and asked how I had survived for the past 5 years, or 4.5, as a lefty. Seemed kind of terrible to ask how I had survived, right? And I sat there and thought about it, but I didn't have any great tips to offer this person. It got me thinking maybe this is something I should look into since it affects my day-to-day life. Going to the internet in preparation for this talk, I found that they didn't have any tips either. So kind of have to wing this. I think this is an important topic to me because not a day has gone by as a surgical trainee that this hasn't come up. You know, you constantly have to reload needles, position yourself in different ways, sometimes switch OR sides just to accomplish the task at hand. Hopefully this will address the I don't know how to help you. I think sometimes, whether you're right-handed or left-handed, instruments are taken away from you when things look awkward, so hopefully this can make the left-handed person look a little less awkward. And for the bulk share of you, at some point you will work with a left-handed resident if you haven't already worked with me. And there, like I said, there are a few to follow, and I'm sure more to come in the years to follow. So let's start with the basics. It is a right-handed world, simply put. You all may recognize these 3-ring binders from the time you were in elementary school, middle school. They're the bane of existence to left-handed people. You constantly have to pull the loose leaf paper out to write on it. And then inevitably, all your handwriting is smudged with the ballpoint ink pen that you use. They've actually devised little devices to protect your pinky from being black and blue by the end. I don't know if they work. I don't personally own one. But if you try it out, let me know. And then these desks. You may remember these. So I was lucky in the great state of Iowa that there was maybe one of these in my entire school. Hopefully it was in the classroom I was in, and hopefully there was not another left-handed person to take it. Otherwise, we just made do. Then there are more subtle things, like can openers. Maybe no one uses these ones anymore with the electric ones available, but they're designed for a right-handed person. Have you ever looked at a keyboard? Do you notice where the number pads are? They're on the right side on purpose. Now, luckily, I don't use this very often, but I imagine if I was an accountant, this would be a problem. Then there's Nintendo game controllers. All the simple movement is done with your left hand, going back and forth. All the complex moves, the punches, the jumps, the kicks, whatever you're doing in the game, are controlled with your right hand. I'm going to say this is why my boyfriend Anthony is better at games than I am, but that might not be the case. Then there are the surgical issues that come up. As all of you know, if you've tried cutting with the Mayo scissors or using your left hand, the blades don't line up right unless you turn them upside down. We'll get into more of the surgical stuff in detail later. Performing a laparoscopic cholecystectomy. You right-handed people may never think about it, but using a Maryland dissector around all those critical structures with your non-dominant hand is fairly challenging. Endoscopy. Again, a simple thing. You think that it's going to be easy for a left-handed individual with all the controllers being with the left hand. But the majority of the movements, the twisting and turning, torquing, countering, clockwise and clockwise, is done with your right hand. And that gets really tiring when you're practicing for your FES exam. Then there's the closing the fascia. No matter how you set up, when you're working opposite a right-handed individual, you guys are going to want to start from the same end every time. To the point to this day, I still have to think about how I like to stand to close fascia because I've been doing it backwards or correctly, depending on who I'm working with, for 4.5 years. So to set the framework for the rest of this, I think it's important to talk about my journey. I started 2,000 miles away in the great state of Iowa. My dad is a left-handed person, so growing up, I spent a lot of time with him. Didn't think anything of being left-handed, probably because when you're 4, you don't care about much other than nap time and snacks. But I grew up with that. It wasn't until I went to kindergarten that I realized that maybe I was a little different. We had this instrument given to all of us on Valentine's Day to make the perfect heart. It was a contraption that I remember it was red and you had to twist and turn it and basically set it up so that you could make your cutting with your right-handed scissors on the right side of this. I can't even remember if there were left-handed scissors, but all I remember is that I couldn't get this thing to work. So instead of helping me, my teacher took it away. I sat for the rest of the class watching people make their Valentine's Day cards, and it was pretty traumatic. Maybe part of this was because the teacher didn't feel comfortable teaching me. She also didn't allow me to come to the school on the last few days of class after I decided on Memorial Day to try to fly out of a tree and broke my left arm. But that's neither here nor there. So then comes baton twirling and why I have props today. So baton twirling is something I did from the time I was age 4. I competed from the time I was 9 to 16. And interestingly enough, I think a lot of the teaching mirrors that we receive in surgery, where someone models what they want done, and you follow and mirror those tricks. Now, when I was following a right-handed instructor and they were doing right-handed tricks, I too did right-handed tricks. Surgery, it's a little different when you're operating on someone's body rather than throwing a metal stick in the air. So I kind of stuck to the left hand on that one. But I think, ironically, I was better at right-handed tricks in this case because the person instructing me was more comfortable teaching right-handed things. And some of the surgical stuff we'll get into later mirrors that the comfortableness of the teacher and the anxiety that the teacher has impacts the impact on the trainee themselves. So here's a list of tricks. I can bore you and read them, or we can just show you some demonstrations. All right, so we have thumb tosses. You have the horizontals that are listed there before. And, you know, sometimes people want to see, can you do it with both hands? And I can. It's sort of tough. Sometimes you can just do flashy things so people don't notice that you're doing anything in particular at all. Some things are a little tricky, and we'll see if we can do it with this on. Arm rolls, elbow rolls, things like catching it behind your head without looking. Still can do all of it, so I haven't lost much, kind of like riding a bike. So, there you go. There's an extra one if someone wants to learn some tricks later. So all of this was in preparation for my very first day as a surgical resident. I thought if I learned how to do baton twirling right-handed and I survived medical school, I was going to be okay as a left-handed resident. So my very first case, really excited to go in. I remember running a baseball stitch with my left hand, and the attending looks at me and goes, "What are you doing? You should be working with your right hand." Being a brand new intern, being slightly terrified, I switched to my right hand. Needless to say, did not go so well. I later tried cutting something right-handed, and I was shaking. That same attending goes, "Why are you shaking?" And I'm sitting there not knowing what to do. I just said, "I'm sorry, sir. I'm left-handed." "Well, then why don't you operate with your left hand?" So I switched back to the left, and that's what I've stuck with ever since. I've made multiple apologies over the last 4.5 years for this, but I think hopefully after this talk I have some ways to help it for the future. I did receive some advice from Dr. Paul Perry when he was a cardiothoracic fellow here, saying that maybe if I put in the extra time early on to be right-handed, it would pay off, because it certainly paid off for him. I didn't really heed that warning. So now we get into the surgical literature. Unfortunately, there may be 40 papers on this subject, since, again, it only affects 10% of the population. But one of my favorites was called The Sinistral Surgeon by Dr. Daniel Chu. It highlights 8 major issues that left-handed surgeons face: anxiety about laterality, lack of mentoring, difficulty handling instruments, difficulty when it comes to minimally invasive things, assisting the right-handed person can be complex, the pressure to change your lateral preference, and disadvantages or advantages with certain procedures. So these 8 things will provide the framework for the remainder of this talk. So the first, anxiety about laterality. We've kind of already hit on this, but as an intern or a second year when you're early on in your career, you spend a lot of time memorizing the steps of each operation, how you can best accomplish it. Add on the additional factor and stress of figuring out, will the instruments work? Will I be able to do the surgery even though I may know all the steps? Am I going to be set up for success? Things like palming the instruments are tough. Luckily, there are people like Dr. Pevic who still believe that the instruments have holes for your fingers for a reason. Sometimes anastomoses are set up for the right-handed person. Like I said earlier, laparoscopic cholecystectomies are challenging surgery in and of themselves for being a right-hand dominant procedure. Endoscopy, again, a subject we've kind of covered. But in addition, there's anxiety, I think, on the behalf of the trainer. It's a little more discomforting to teach someone outside of your comfort zone. I think Dr. Campbell put it best when I was talking to him about this potential subject for my grand rounds. He said that as an attending, you've learned the steps, you do it over and over and over, to the point where you don't think about the operation. You do the same steps every single time so as not to mess up. When you throw in a left-handed individual into the situation, you have to go back to the drawing board and almost relearn the operation, because it makes it feel like you're setting it up backwards. A lot of studies, of the 40 studies, a lot of them do look at this, the mentor's feelings in regards to a left-handed trainee. In this particular one that was published in the American Journal of Surgery last September, they interviewed 25 left-handed and 65 right-handed surgeons. Basically, they sent out a survey and they took the responses that they got. 46% of the right-handed surgeons reported difficulty teaching the left-handed person. 28% versus 4% of the left-handed surgeons felt less comfortable teaching a left-handed individual. 15% surveyed felt that left-handed trainees actually had less technical ability. And what they found when looking at all these answers in bulk is that main disadvantage was actually the barrier to training, the comfort level of the trainer rather than the technical ability of the trainee. And some of that I think also ties in with this, the lack of mentoring on lateral preference. So first of all, I think some of this happens because left-handers are commonly ambidextrous. Like I said, of those 10 attendees I worked with, I've seen varying degrees of how much they use their left hand. There are also less left-handed surgeons to be mentors in the first place. And there's no guarantee at small programs especially that you're going to be able to pair a left-handed individual with a left-handed trainee. Another survey of left-handed surgeons in 2 areas of Brooklyn, they had 69 respondents in total. Only 3% of the trainees actually reported laterality mentoring. And there's other things that will come up later from this particular survey, so this is an important one. So what happens if you don't get laterality mentoring? So 97% of people just went through training like everyone else. They did a study at UC Irvine Medical School. They took only 19 people in total, 8 left-handed trainees and 11 right-handed ones, and they put them into a curriculum. half of them were put in something that was concordant with their hand dominance, and then the other half were in discordant teaching. They were taught over 3 weeks how to do basic surgery procedures. They had 2 tasks to perform: a running suture and instrument knot tying. And not surprisingly, those who were in the discordant teaching environment performed worse on both tasks. So although maybe there's some element that's due to anxiety on the behalf of the trainer, maybe it's the environment that we're putting left-handed trainees in that makes them unsuccessful. Part of the environment is difficulty handling traditional instruments. So things like palming instruments, Mayo scissors, Wheatlanders, all things we've gone over before are particularly difficult. But things like the operating room setup are also difficult. If you look at where the book Walter is on this, do you see that post? It's on the upper left-hand side. So if you're the resident that's assisting and you're allowed to do the pancreatic OJ when you're working with Dr. Bold, that post is in the way. If you're doing an open cholecystectomy and you happen to be on the patient's right side, again, that post is in the way. You can turn your body as much as Dr. Greenholz would ask you to turn your body, but sometimes the post is still in the way. And I think that's something that comes out that we can avoid too. But when it comes to the instrument laterality, so that left-handed surgeons, are they left out? The one I mentioned before is really important. They looked at this survey, and 13% of people were exposed to left-handed instruments. And I think, unfortunately, most left-handed trainees just adapt to traditional instruments. And unfortunately, I had an updated version, but I had a picture of Jimi Hendrix. He was playing the guitar, and if any of you know, he was a left-handed guitarist, and he actually flipped the guitar upside down in some cases to play upside down, and he even restrung his guitar backwards. So there are ways to make it work, but I think most of us have just adapted. Difficulty with minimally invasive surgery. Now, interestingly, I would argue that laparoscopic surgery has kind of leveled the playing field for left-handed individuals, partly because both of your hands need to be functional, right? And being in a right-handed world, I think we're forced to use our right hand more than right-handed people are forced to use their left hand. But like I said, there are difficulty with specific surgeries, like the laparoscopic cholecystectomy. Now, I want you all to think about this for a second. So if you were asked to do a lap chole with your left hand, how many of you, raise of hands, would feel comfortable using your left hand to dissect around the cystic artery cystic duct? That's kind of what I expected, a mix here and there, but overall, a little scary. So there it is. Just think about that for a second. All right. The other thing that we always worry about as residents, and I don't think this is limited to left-handed trainees, but feeling like you're not assisting your attending. Like I said earlier, closing fascia is something that I feel like we're backwards on a lot. A simple fix is just switching the OR sides of the table. Although maybe that's an inefficient move and adds 5 seconds to your surgery, I think it's something that maybe is an easy fix to set a left-handed trainee up for success. Completing anastomoses that are set up for the right-handed individual. Again, switching sides of the OR table. Failing to use the Mayo scissors correctly. Well, you either learn to use them right-handed or learn to cut upside down. I think the theme here in the inconvenience in assisting the surgeon is really just asking for things to be changed for you. You know, it's scary when you're a resident, I think, but the simple asking to switch sides of the table. That survey that they did on the people being left out, it looked like 50% of people had to constantly remind people that they're left-handed in the operating room because people forget. Only 1/3 of the surgeons in that case actually had preference cards that stated they were left-handed. So kind of a problem. The pressure to change lateral preference. This is kind of an interesting one and probably one I deal with every day. There's the overt, can you do this right-handed? Again, another audience participation event. How many people here have been asked, can you do this left-handed? No. It comes up more frequently than you think. And sometimes you oblige if it's something simple. Sometimes I've had to say, no, I can't do that right-handed. Then there's the more subtle instruments just being taken away because it looks awkward. Hopefully after this, we can set people up for success so that the instruments aren't taken away. So I thought this one was interesting, though. So in cardiac surgery, where everything is very methodical, step by step, you would think that everyone adapts to the right-handed world. Everyone does right-handed things. For instance, in Nebraska with liver transplant, there is a left-handed surgeon there that they basically told you have to do this right-handed because that's how we do it here. But this person that came up with the tips for the left-handed trainer or trainee said, use your left hand. Don't try to be right-handed because ultimately you'll never have the same dexterity. Ask for modifications. Tell the scrub that you're left-handed. Like I said, only 50% of people it was remembered that they were left-handed, and only a third of people had it on their case card when they were the attending. Ask to switch sides of the table and ask for left-handed instruments, if available. Granted, at this point, I don't know if I would even know how to use a left-handed instrument, and packing one from place to place that we rotate is probably a problem for multiple reasons, but sterility being one of them. And they cost quite a bit. I looked on Amazon yesterday, a needle driver costs like $125. So I think it's a little unreasonable to provide a tray for each resident. So we'll just get by. The seventh point, and almost done, possible disadvantages with certain procedures. Like I said, laparoscopic cholecystectomy is one, endoscopy being another. And as you can see, again, controllers on the left side, the dials for up and down, left and right, but the majority of the movement is done more subtly with your right hand. Possible advantage with situs inversus. Now, I've only heard of one case from AJ that there was a person that needed their gallbladder out with situs inversus that he got to do. Asked me where I was the night before when he was on call. Now, would have been good to know at the time, but like I said, I've adapted at this point to doing it right-handed, so I don't know how successful I would have been. I think there's also advantages with certain procedures on the left side of the body. The colectomies, when the majority of your work is done with the retraction, it makes sigmoid colectomies, left colectomies, in theory, a little easier for the left-handed person if you're doing the bulk share of your retraction with your left hand. But let me know if you ever need assistance if you find another one of these. So in conclusion, kind of all of this, I think the basic thing is to remember to ask for help. Ask for modifications to ensure your success. And I think in some respects this applies to the right-handed trainees that are my colleagues. But the most important fact that I took from the sinistral surgeon is that despite the limited studies, there's not a single one that says that left-handed people have inferior outcomes to right-handed surgeons. So for all you lefties out there, it's okay. So at this time, I want to thank all of you for tolerating my left-handedness for the last 4.5 years. I know sometimes it can be painful. And I want to thank my classmates who this wouldn't have been possible getting through all this without, even though I've left some of you behind in research. You're still always going to be my class. No offense to my current one. So thank you guys.
Great, Brie, and I'm 100% convinced that there's not somebody in here who could do the baton twirling as well as you. So you may be left-handed, but you have lots of skills. In addition, we have some time for questions. Yeah.
It was a great talk. I'm left-handed myself. As a second-year resident, I was called handicapped by my chair. So, you're left-handed, you're a handicap. Just accept that. And it created like an internal conflict in me. Should I switch? Should I not? And then finally, after reading all these papers that came up at the time, I decided to basically try to switch and see what would happen. So I started by doing simple tasks like brushing my teeth with my right hand, shaving, doing everything at home with my right hand, and training in the lab. Like whenever I had some time, I would take a needle driver and just suture and suture and suture. And then I finally was able to make the switch, and now I operate with both hands. So, and I ask residents now which side of the table do you want to be on, so I can, we can do the case together. It doesn't matter to me. And I'm basically committed. When I see a left-handed resident, I'm like, they have a special place in my heart. I've been through that. Now, comment about left-handed instrument. That's, I think, it's one of the fastest ways for me to irritate some of my attendings in training. Because I had a tray as a resident. It was the Halaby tray that the nurses would open before every case that they can see me scrub in. It had a left-handed needle driver, left-handed nail, and some left-handed clamps. And they were basically donated by one of the surgeons of my institution, who was a colorectal surgeon. And she basically said, I'm going to try to help you with that. Well, it turned out that the other right-handed surgeons did not like that because then if a left-handed instrument falls into the hands of a right-handed person, it creates a lot of frustration.
You might do it.
And then, one time I had to tell my kid, well, welcome to my world. This is how I feel every time I try to use a right-handed instrument. But then, you learn to adapt. Now, one thing about newer technologies out there, they can help left-handed people. When you're using the robot, there is a switch where you can switch hands. So you can use, even if the instruments are positioned in such a way, you can toggle back and forth. You can switch the instruments on the robot and put let's say the scissors, even though it's on the left, you can work it with your right hand and vice versa. So the robot helps a lot. And there's I would like to say that left-handedness is actually the last unrecognized minority in surgery. And there should be an association of left-handed surgeons.
So I'm coming out as well. I grew up in an era where there was not any dialogue on any accommodation to a left-handed person. And there's obviously the issues of the ergonomics of the instruments that you just can't overcome without left-handed instruments. But this is where you take some adversity and potentially you turn it into some greater efficiencies. So the first thing I think that brings light to is that the non-dominant hand is always doing something when you're operating. So it's not this left behind hand. So when you're operating, even though you have your dominant hand doing one movement, the other one is doing something. It's retracting, it's blotting something. So that non-dominant hand is underappreciated. So you should always be doing something with that. And as far as turning the adversity into an advantage, is that I learned to do things so my definition of, or what I've been told, definition of ambidextrous is being able to do something equally well with both hands, which is not what I am. But I've adapted to do things fairly well with my non-dominant hand. And so I can operate simultaneously, I think, and instead of switching sides or doing something, I can pick up an instrument and do it with either. And so that's where I think I picked up some efficiencies that if you rely solely on your dominant hand, that you don't have when you're a left-handed person adapting to the right-handed one.
Dr. Perry, I saw your hand up earlier.
Yeah.
Should we have all the lefties stand up?
Yeah. Well, for me, I kind of realized early on that everything was set up for right-handers, so I might as well just get on board, join the party. But having said that, as I've kind of come into my own and found my own way of doing things and setting stuff up for myself, I agree. I find certain ways I can more efficiently use my left hand to accomplish a task where if I didn't feel as comfortable using that hand, I might not do that move in that way. So kind of just try and get the best out of both hands. But I think for especially the things we do, anastomoses are set up a certain way. All the angles are set up a certain way. It's just a little easier for a lot of the type of work we're doing just kind of do it in a right-handed way.
Gosh, lots of hands up. So let's go to Nihilus. Go behind you.
Yeah, well, Brie, my girlfriend in high school was a head majorette, so thanks for that. I haven't seen somebody pull up the con in a long time.
That's enough.
There's a flip side to your story for all the right-handers. I grew up in a time where faculty, of course, could be quite imposing, and the doctors and the surgeons and the resident faculty used to eat together in the same dining room. So my favorite mentor used to make me eat left-handed. If you can imagine, he would just say, learn to use your left hand, eat left-handed, and he would let me go through all the little things like opening doors left-handed and really forces us to use our left hand in the operating room. So for the right-handers in the room, I think it's important as well. If you can use your left hand well, you're going to be a much better surgeon, and you ought to really try to make that happen for yourself.
And I think it's a very, because you do learn to do things both-handed, and sometimes a little bit more awkward on one side or the other. The other thing is I remember being traumatized in the mid-'80s when I went to an SUS meeting, and Jack Pickleman stood up and gave presented an abstract, or presented a plenary session of if you were left-handed and female, you couldn't be a surgeon. And obviously, Brie has definitely put that to rest. But I think the other thing is that this is a long-standing, shall we say, bias that has been there.
Dr. Parker.
So, thank you, Chris. I was just going to mention Dr. Pickleman's paper from Loyola, where I trained. So, in the mid-'80s, you know, God forbid you were left-handed. God forbid you were a woman. Double God forbid you were a left-handed woman, which there were none, because one or the other was bad enough in his eyes. So it kind of shows how far we've come, but that was the era at that time. And being at Loyola, you were well aware of that paper every single day on the social studies.
Lisa?
Actually gives me happy that our subspecialty is actually a little bit open-minded in one regard, and that's in terms of, because a lot of your papers were from cardiothoracic surgery. I graduated with all those names, so that's good. My main mentor, Alex Patterson, who's internationally known thoracic surgeon and did the first lung transplants in 1980s, was left-handed. And it's odd thinking back to operating with him. I don't even remember noticing it. So I have to go back and ask him, like, what he does, because in the 2 years, I never looked at him and thought, well, that was I don't really know what he did. But everything he did looked super smooth and super slick. So that's a non-issue. But you're right about, I think you're right about minimally invasive surgery kind of leveling the playing field, because I'll tell you with robotics, now that there's a stapler for the XI, and one of the main things we do is staple everything in sight when we're doing a lobectomy, is you're not, I realized quickly that you're not going to get the angle around the pulmonary artery or this, that, or the other thing coming with your stapler from the right side. So I equally have to be able to staple and be comfortable bringing this thing that looks like a torpedo into the chest, getting around the PA branch and stapling. So, I think Dr. Young's right, and everyone else has said the right hand we need to use the left hand.
Great.
So, Brie, also coming out of the left.
This is a great session. Everybody, I want you to feel
I've often gotten the, can you do this right-handed? And so my question for you is, in a few months, you're going to be attending on your own out there. Are you going to ask, can you do this left-handed? Because that is my dream, is to someday.
Probably not. Mostly because I don't think I get residence at Kaiser Roosevelt. And I don't think I'm going to ask the senior faculty or proctoring me. But maybe if I get the opportunity.
Keep it in mind.
One thing I want to comment is that I was advised as a resident intern is that whatever you do everything forehand, any task that you want to do. So the way I look at it, if you're left-handed, then use your right hand for anything that you have to left hand. That's all. Then it eliminates whether or not you're right-handed or left-handed. Besides the fact that you have to train yourself. But I think one of the things that we missed too is that we focused on this instrument and your left hand, your right hand. And it's unfair to say that a cholecystectomy or laparoscopy is designed for a right-handed man. It's not true. The reason why it makes it intuitively makes sense to do it with the right hand because the principle of surgery is that try not to dissect through the common bowel duct. So if you think about it, like Dr. Brown just said, on a pulmonary artery, try not to go from right to left. You have to, so then, therefore, you need to think about the principle of surgery and challenge yourself whether or not you will be capable of doing everything forehand with both hands. And if you can do so, then it's irrelevant after that. Now, I'm not talking about instrument. I'm talking about the principle of surgery.
art and a science. Dr. McVicker,
Good question. Which arm did you break in kindergarten?
My left one, actually. But then I destroyed my right thumb in volleyball in high school, which is what kind of ended the baton career, so.
All right. Thank you, everybody. On that note, then we'll take the ball.